Hello, and welcome to Portland Public Health's Community Health Data Digest. My name is Hayley Prevatt, and I'll be your narrator on this journey. I want to thank you first for your interest in the health and well-being of our unique city, Portland, Maine. I'm glad you're here, so let's get started. We have a lot to cover in this presentation, and I hope you stick with us until the end. I'll first walk you through why we're here today. Then we'll dive deep into the health data we've put together. And last but not least, I'll share with you how to give us your feedback on the data shared today. The data presented were collected and analyzed over a year's time. We used a combination of our own data collected throughout our programs and data collected by other entities to provide us with a better understanding of the health of Portland's residents. Portland Public Health Division is an accredited health department and has been since 2016. Accreditation assesses a health department's ability to address the 10 essential public health services, as seen on this slide. Portland Public Health has demonstrated success in all essential services and has made the commitment to continuing and improving our work in these areas. One requirement of an accredited health department is to conduct a community health needs assessment and community health improvement plan once every 5 years. And this is why we're here today. All data covered in this presentation today can be found in our Health of Portland report. This report serves as our Portland-specific health needs assessment and contains both numeric data and storytelling to provide a broad picture of the health status and factors influencing the health of Portland residents. The Health of Portland report creates opportunity to improve health outcomes for all Portland residents and was designed to be available and accessible to all who wish to utilize it. It's the community's data. We think of the HOP as the what. It shows us what's happening in the community, but we're looking to you to tell us why things are happening and how we can work together to continue addressing these health concerns. Your feedback and opinions will help Portland Public Health create our community health improvement plan, which will guide us over the next few years. Towards the end of this presentation, there's a link to our community health improvement survey. We encourage you to watch first this presentation and review the data in the Health of Portland report before taking the survey. So let's jump in. The data we're about to review together is only a snippet of what's inside the Health of Portland report. Much of the data contained in the report are Portland specific, but some data was not available. In those cases, data at the county level were added. If you're looking to see how Portland compares to Cumberland County in the state of Maine, check out the appendix in the back of the Health of Portland report. Where available, comparison indicators were included. Throughout this presentation, I'll also let you know how Portland compares through a series of weather icons. When you see sunshine, you'll know that Portland is performing well. When you see a partly sunny icon, Portland falls between the county and the state. And when you see a rainy icon, Portland is not performing as well. So here we go. First, let's take a look at who Portland is. In order for us to fully understand what's happening in Portland, we first need to understand who calls Portland home, and that's where demographics come in. Looking at the age composition of Portland, 5% of the population is between the ages of 0 and 4, 11 is between 5 and 17, 45% is between 18 and 44, 25% is between 45 and 64, and 14% is 65 plus. Our median age is 36 years old. The age composition is much different than the rest of the state, where the median age is 44. There are 3,053 veterans in Portland, roughly 4% of the population, and about 9% of the population is disabled. Portland's race and ethnicity looks much different than Cumberland County and the state. 13% of Portland's residents are foreign-born. This is compared to 6% of Cumberland County's and 4% of Maine's population. Last but not least, 65 different languages are spoken across the city. This is important for us to note, especially when we start planning programs and initiatives. We want these to be welcoming and available for all of our residents. Our health is determined in part by access to social and economic opportunities, the resources and supports available in our homes, neighborhoods, and communities, the quality of our schooling, the safety of our workplaces, the cleanliness of our water, food, and air, and the nature of our social interactions and relationships. All of these factors combined are called the social determinants of health, and these conditions in which we live explain in part why some Americans are healthier than others. This image really helps to explain all the factors that influence our health. You'll see that 50% of our health is determined by the conditions of our zip code. Looking at some of those factors more closely, we can see that in terms of education, 53% of third graders scored proficient or above in reading. 16% of students missed 15 or more school days in a school year. Looking at poverty and food insecurity, we can see that 26% of children and 17% of adults live below the federal poverty line. 47% of Portlanders live more than a half a mile from the nearest grocery store, meaning that their ability to buy fresh and healthy produce may be limited, especially if they don't have reliable transportation to get to and from. Looking at housing, 40% of households spend 30% or more of their income on housing costs. And lastly, looking at language access, 15% of Portland's population sometimes or always speak a language other than English at home. This means that they likely prefer to speak in a non-English language, and that may play a part in their ability or inability to access services and programs. Next, we look at community assets. This really focuses on factors in our community that protect and encourage good health. Individuals and populations are able to achieve better health when they have access to a variety of important health supports or health assets like parks and playgrounds, neighborhood associations, walking paths and trails, faith-based organizations and nonprofits, municipal services, emergency services, school and public institutions, and natural resources. Portland excels in many of these areas, particularly in parks and playgrounds. 87% of Portland residents live within a 10-minute walk for green space. That's compared to only 28% in Cumberland County. Additionally, Portland scored a walkability score of 61 out of 100. And compared to the largest 500 cities in the United States, we perform better. This means that some errands can be done on foot. As a health department, it's important for us to understand our residents' insurance status and to understand who is regularly engaging the healthcare system. For instance, looking at access, 10% of Portland residents do not have health insurance. This uninsured percentage is higher than both Cumberland County and the state. Additionally, there are more primary care providers, dentists, and mental health providers per person in Cumberland County. Looking at preventative services, 69% of adults in Portland receive routine wellness checkups. When we dive deeper into this and look at just the elderly, we see that 36% of women and 44% of men are up to date on preventive services, which include the flu shot, the pneumococcal shot, colorectal cancer screening, and mammograms for women. Moving next to maternal and child health, improving the health and wellness of mothers, infants, and children is important because their well-being determines the health of the next generation, and Portland is performing very well in these indicators. Looking at pregnancy wellness, 88% of births had prenatal care that started in the first trimester. 3% of mothers smoked cigarettes during their third trimester, and 36 drug-affected infants were reported per 1,000 births. These reports are made from physicians when they have reasonable cause to suspect the baby may be infected by substance use or demonstrating withdrawal symptoms. Compared to Cumberland County and the state, Portland is performing well. Additionally, 97% of babies are fed breast milk at some point in their development. Next up is chronic disease. This is a pretty busy chapter because chronic diseases are defined broadly and encompass many health outcomes. Chronic diseases are conditions that last 1 year or more and require ongoing medical attention and/or limit daily activities of living. This chapter includes topics like diabetes, tobacco use, and obesity. Here we focus on nutrition, physical activity, and weight. 1 in 4 adults in Portland are obese, performing slightly better than Cumberland County and the state. 18% of adults report no leisure time physical activity, which means 18% of Portland adults choose not to spend their free time doing physical activity. Looking at these same categories in the youth, 1 in 10 high school students is obese, roughly on par with the county and better than the state. 17% of high school students report meeting the physical activity recommendations of 60 minutes per day. Looking at tobacco use amongst adults and high school students, 17% of Portland adults are smokers. 8% of high school students reported using tobacco in the last 30 days. This does not include the use of vaping products. 29% of high school students used e-cigarettes in the last 30 days in Cumberland County. This statistic was not available for Portland students and is slightly higher than the state percentage. Now let's look at cancer. This chapter includes indicators on many different types of cancer, from bladder to skin to lung. Today we're going to look at two cancers for which we have screening data available. Screening is an important public health initiative, and screening data allow public health departments to plan and evaluate efforts. 2 cancers we have screening data for are colorectal cancer and female breast cancer. Looking at colorectal cancer, there were 38 new cases and 14 deaths per 100,000 people. And 74% of adults aged 50 to 75 received a colorectal cancer screening. Looking at female breast cancer, there were 121 new cases of female breast cancer and 19 deaths per 100,000 women. 73% of women aged 50 to 74 years old have had a mammogram within the last 2 years. Moving on to infectious disease. This is important data for us to know because infectious diseases remain a major cause of illness, disability, and death. This is a full chapter, but for this presentation, let's look at a few indicators where Portland is performing poorly. Looking at chlamydia, there are 492 newly diagnosed cases. We saw 146 newly diagnosed cases of gonorrhea, 29 newly diagnosed cases of infectious syphilis, and 339 newly diagnosed cases of chronic hepatitis C per 100,000 people. Now let's look at environmental health. This chapter is important because the interaction between humans and our surrounding environment affects our quality of life, the years we live a healthy life, and health disparities. This chapter looks at pollution, asthma, tick-borne diseases, and lead. So let's start there. 53% of the housing units in Portland were built pre-1950s. This was a time when lead was used commonly in building materials and paint. When looking at the housing stock and poverty together, Portland has a higher lead exposure risk index of 9 out of 10. This means that Portland residents are at a greater risk of lead poisoning. Additionally, 49% of Cumberland County children diagnosed with lead poisoning live in Portland. Looking at tick-borne diseases, there are 45 new cases of Lyme disease per 100,000. Lastly, looking at asthma, there were 85 asthma-related emergency department visits per 10,000 people in Portland. Next, we look at injury and exposure to violence. While oftentimes injuries are accepted as accidents or part of life, many result in disability or death and are largely preventable. Here, we look at violent crimes as a whole and a few specific unintentional injuries. There were 279 violent crime offenses in Portland per 100,000 people. These crimes include murder, aggravated assault, and robbery, among other things. Looking at unintentional injury, there were 39 poisoning deaths per 100,000 people. These deaths do not include overdose deaths. There were 5 motor vehicle traffic crash deaths, 409 fall-related emergency department visits per 10,000 people, and 24 fall-related deaths per 100,000 people. Both of these statistics are significantly higher than the county and the state. Now let's look at mental health. When someone has good mental health, they likely are more productive, have stronger, more fulfilling relationships, and have the ability to adapt and change to cope with challenges. Mental health is essential to well-being, and mental illness are among the most common causes of disability. Diving in a little bit, Portland Portland Police Department fielded 5,509 behavioral health-related calls for service. These calls include suicide attempts, suicide threats, and other behavioral health needs. There were 297 mental health emergency department visits per 10,000 people, and this is significantly higher than the county and the state. Lastly, looking at suicide and suicide ideation, 14% of high school students and 21% of middle school students have seriously considered suicide, while there were 13 completed suicides per 100,000 people. Moving on to substance use. This is the only subject that has 2 chapters in the Health of Portland report. It's a big topic with a lot of data to report on, so let's dive in. Looking at alcohol, 37% of middle school students and 58% of high school students believe alcohol is sort of easy or very easy to get if they wanted to. 26% of high school students use marijuana at least one time in the last 30 days. And looking at injury and death due to substance use, there were 22 substance use hospitalizations per 10,000 people, 17 alcohol-induced related deaths per 100,000 people, and 34 total opioid-related deaths and 44 total overdose-related deaths in Portland. We also wanted to take this opportunity to highlight some of the work of our needle exchange program, which was the first program like it offered in the state. The needle exchange collected and disposed of 204,259 syringes and distributed 199,439 syringes. They also made roughly 16,000 referrals to needed services, with the top 3 being primary care, housing, and our very own STD clinic. Last, but certainly not least, let's talk about death and dying. While this might be a hard discussion, it's incredibly important data to have. This allows us to look at dying as a whole and attempt to build programming around preventing preventable or early death. Looking at Portland's all-cause mortality, cancer is the biggest culprit for Portlanders at 167 deaths. We had less heart disease deaths in Portland at 133 deaths per 100,000 people. Looking at unintentional injury as a whole, we had 59 deaths, 46 deaths due to chronic lower respiratory disease, and lastly, there were 32 deaths due to stroke per 100,000 people. Now, that's it for the data in this presentation. I hope you're all still with me. In case this wasn't enough data for you, go ahead and download the entire Health of Portland report, which includes over 150 health indicators, stories and updates from all public health division programs, and sources and definitions for all included indicators. Additionally, the report was translated into 5 different languages: Arabic, French, Spanish, Portuguese, and Somali. Now, for the takeaway, our call to action. We'd love to hear from you. We're gearing up to complete our Community Health Improvement Plan that will guide the division over the next few years. And we're looking to you, the Portland community, folks who live, work, and play in Portland, to tell us what you're seeing in the community and what's important to you.